Welcome back to my channel Knowledge Chronicle.
Have you ever wondered why some couples, despite trying everything, are still unable to conceive a child? In a country like India, where becoming a parent is often seen as the ultimate goal of marriage, infertility remains a topic that's both emotionally painful and widely misunderstood. Today we are diving deep into one of the most sensitive yet important aspects of reproductive health: infertility. We'll understand the reasons behind it, explore cutting-edge technologies that offer hope, and break myths that still haunt our society. So let's begin this insightful journey. Infertility is defined as the inability of a couple to conceive a child even after 12 months of regular unprotected sexual intercourse. It's a condition that affects millions of couples across the world. And yes, India too. Contrary to popular belief, infertility is not just a female issue. In fact, studies show that male partners are responsible in nearly 50% of the cases. There are multiple reasons why a couple might face infertility. Physical causes, like damage to the reproductive organs due to injury or surgery. Congenital reasons, defects present since birth, such as blocked fallopian tubes or undescended testicles. Diseases, conditions like PCOS, polycystic ovary syndrome in females or varicocele in males. Drug use, overuse of anabolic steroids, alcohol, or even some antibiotics can affect fertility. Immunological causes, where the body starts attacking its own sperm or eggs. Psychological stress, believe it or not, emotional stress, anxiety, or depression can disrupt hormone levels and menstrual cycles. And yet, in Indian society, females are often blamed, even when medical evidence shows the issue lies with the male partner. Now let's talk about how modern science is offering hope to infertile couples. One of the most advanced solutions is assisted reproductive technologies, or ART. These are a range of medical techniques that assist couples in achieving pregnancy. Let's explore them one by one. IVF, in vitro fertilization, often known as the test tube baby technique. In this process, the female's egg or ovum and the male's sperm are collected. Fertilization takes place outside the body in lab conditions that mimic the female body. Once a zygote or fertilized egg is formed, it is allowed to develop into an embryo. Here's where it gets interesting. If the embryo is at an early stage with up to 8 cells called blastomeres, it is transferred into the fallopian tube. This is called Zift zygote intrafallopian transfer. If the embryo has more than 8 blastomeres, it is placed directly into the uterus. This is called IUT intrauterine transfer. GIFT gamete intrafallopian transfer. Here, a healthy ovum is collected from a donor female and directly transferred into the fallopian tube of another woman who can't produce eggs but has a healthy uterus. Fertilization occurs inside the body or in vivo. ICCSI, intracytoplasmic sperm injection. This is a more advanced IVF technique used especially when the male has very low sperm count or poor sperm mobility. A single healthy sperm is directly injected into an egg using a fine needle in a lab. Once fertilized, the embryo is transferred back to the female's body. This is one of the most precise and delicate procedures in reproductive medicine. Artificial insemination, or AI, is a technique that helps when the male can't properly inseminate or when his sperm count is too low. Here, sperm from the husband or a donor is artificially introduced into the female's body. If introduced into the vagina, it's called AI. If introduced directly into the uterus, it's called IUI intrauterine insemination. While these technologies offer great hope, they come with some limitations. First, there's the cost. These procedures require sophisticated equipment and skilled professionals, which makes them expensive and available only in select fertility centers. Then, there's the emotional toll. The emotional burden of multiple procedures, waiting and societal pressure can be overwhelming. And finally, cultural and religious resistance. In some communities, ART is not easily accepted due to ethical or religious beliefs. Here's something very important. India is home to millions of orphaned and abandoned children, many of whom may never survive without a loving home. Legal adoption is not only permitted in India, but is also a beautiful way for couples to experience parenthood. It's one of the most meaningful and impactful decisions a couple can make, giving a home to a child in need, while also fulfilling their dream of being parents. Infertility may feel like the end of the road for many couples, but medical science has opened new doors of possibility. Whether through advanced technologies or adoption, there is hope, and there are choices. Remember, infertility is a medical condition, not a curse or a judgment. Let's break the stigma and create awareness.